Good afternoon. I'd like to call the Health and Human Services and Aging Committee to order. Today is Tuesday, November 29th. It's not our regularly scheduled committee, but in light of end of the year, we're trying to tidy up things with the old administration, so everything today will go second reading suspension. Can I have a roll call, please?
Good afternoon, everyone. It is now 3:04 p.m., and as a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll, Ms. Conwell.
Present.
Mr. Sweeney.
Present.
Mr. Miller.
Here.
Ms. Stevens. Ms. Stevens is absent. Ms. Turner.
Here.
You have a quorum.
So I'd like to make a motion to excuse Councilwoman Stevens. Is there a second? It's been moved and seconded. All in favor, please say aye. Aye. Just as a disclaimer, we do not need to excuse for committees, but we do. Anyone signed in for public comment, Madam Chair?
Yes, Catherine Raudabush.
Welcome.
Hi, how are you? So I've been spending the
Excuse me, if you could state your name for the record, please.
I've been staying at the Norma Her Women's Shelter for the last 5 months or so.
And if you could speak a little louder into the microphone, please. Thank you.
You could take your mask off if you feel comfortable.
Just matter if I start coughing or not, but so I've been there for 5 months, and there's some kind of health concerns about that place that have come to question in my head. And since October, I've been sick twice with respiratory infections. So one of the biggest concerns or major concerns is the downstairs bathroom. There's stuff seeping out of the bottom of the toilets. There's sewage smell. There's sewer flies at times. And the other thing is, it's just when you have I guess you have a lot of people, and there's no real set rules how to keep people from getting infected all the time, because it seems to be like a repetitive thing there with people. Since Corona, we don't, and the mask mandate has been taken away, we don't have it. It's up to us, and a lot of people don't follow this rule. And it's not helpful for others that don't want to get sick. Like I don't get sick very often, and now I'm getting sick a lot. That's pretty well all I have to say.
This is not a back and forth forum. As well as I'm taking notes, there are staff in the back that take notes,
Okay.
and we will address those concerns.
Okay, thank you.
Thank you for your comments.
Lou?
Good afternoon, everybody.
Good afternoon.
This lady there, she had to file a grievance. I believe all of you have received it already. It was sent a little bit earlier before this meeting. And all of a sudden, she got a response. For all the help she has asked for, it was basic human needs. Our shelter system cannot even fulfill human needs. No way to be responsive. So, for example, the past weekend, we had a great Thanksgiving, supposedly. However, something happened to a particular bathroom which has multiple shower stall and toilet stalls. That one got locked out. So now you have how many people have to use a little bathroom with only 2 toilet stalls and 1 shower stall? Of course, definitely this particular bathroom will run out of toilet tissue, liquid soap, everything. Public shelter is to help people. However, the shelter system has never been fulfilled the purpose to have a public safety and public health in mind to help people out. This is the reason why if people have 2 cycles of respiratory infections outside of the HALE or 2100. Inside of these places, you can have 3 cycles or 4 cycles in there. Then you will say, it's your choice to come to state shelter. What kind of choice nowadays today people will have if they cannot afford, don't even say mortgage, to pay rent? Street or shelter? Which one? Do we really care about people's life just because you fall into the hardship of being homeless, so your life doesn't matter anymore? You can be bossed around, harassed around. That particular Friday when Mr. Sweeney tried to come in, this HALE tried to beautify the place since Thursday. Friday, 6 p.m., we start getting threatened. We were rushed just like we were cattle, dogs, whatever. We were rushed to go here, to go there, whatever, because they want to beautify the place. But still, sinks, toilets are still clogged. Rooms are still leaking. Food is still bad. Mold is still growing. Please help us, because you have the power. You can make a better decision. If they don't know how to do the job, please let them go. It's bad for their mental health as well. They made a choice. But if they don't want to do the work you actually want them to do, please let them know there's a consequence. Thank you very much.
Thank you, Ms. Liu. Anyone else, Madam Clerk?
That concludes the public comment portion for today's meeting.
All right, thank you. Approval of the minutes from the November 16th, 2022. Can I have a motion?
So moved.
Second.
Okay, been moved by Turner, seconded by Miller. And Madam Clerk, is there anyone that needs to leave early?
Not that I'm aware of.
All right, then we can have them in order. If you could read the first item into the record, please.
Resolution 2022-0435, making an award on requisition 7603 to Canopy Child Advocacy in the amount not to exceed $5,800,000 for implementation of a child protection team's model to address and prevent child abuse in Cuyahoga County for the period January 1st, 2023 through December 31st, 2025.
Everyone, as you come to the mic, can you state your name for the record and speak into the mic and make sure that the green light is on? Thank you.
Good afternoon, David Merriman, representing the Department of Health and Human Services. Before we jump into this first item, I first want to thank Councilwoman Conwell and Council staff for organizing today's schedule. It's 2 committee meetings this week, ensuring that all items make it through the legislative process before the break at the end of the year. So thank you very much for doing that. The item before you today was recently also reviewed as it related to its appropriation. And so there's going to be a very brief presentation that will speak to some of the additional questions. This is a multi-year contract for the Child Protection Team. I'm going to go ahead and invite Jennifer Johnson up. She's going to lead us through the presentation. And given the fact that there are quite a few items on today's agenda, I want to make sure every item has an opportunity to present. So I've asked all of our presenters to please make their comments brief and to the point. Thank you.
Thank you.
Good afternoon. Thank you for the opportunity to be here again. I think that you guys have the presentation already, but if not, I can send you the slides. I did include some of the slides that we had presented before. Again, my name is Jennifer Johnson, the Executive Director of Canopy Child Advocacy Center. I apologize for not introducing myself. In 2021, as you know, there were over 12,000 reports of child abuse concerns to the hotline that were screened in, and over 58% of those were abuse. Calls are still on par to be exactly like that number from 2021 into 2022. And as a result, we're seeking funding for $2 million over a 2-year period to be able to respond to up to 1,000 children that experience physical abuse and develop a child protection team model to bring to Cuyahoga County. One of the things that was asked of us after we presented the last time to this committee was about our accreditation status. Canopy currently has full recommendation from the National Children's Alliance to receive accreditation. The National Children's Alliance is the body that accredits CACs across the country. There's over 1,000 CACs in the country. And the standards are, to the right on this slide, they're focused in on making sure that we adhere to best practice for a child advocacy center model. It would be our intention to continue to maintain this status. We have to apply for the status every 5 years. And we have had an associate status since 2019, and just this October, on the October 25th, we received a full recommendation to be fully accredited by the National Children's Alliance. There was a specific question, as we talked about in the last committee, about 4E eligibility and the numbers of kids that come to the CAC. So I've asked David Merriman to come speak on behalf of the county on how we're going to specifically identify that process.
Again, David Merriman. 4E is a form of federal reimbursement. What it looks to do is it establishes that a child is in custody, that services are being provided to that child or is a candidate in custody, and that the services meet certain criteria. I've begun to review 4E eligibility and reimbursement as a part of our work with the state of Ohio, looking at both how the county can begin to apply 4E funds for kids that are in custody as well as candidates for custody. And this is something that we're going to be heavily focused on in the coming months and look to report back as soon as we have a status change.
Ms. Johnson?
Yes,
You can manipulate your slideshow by clicking that little clicker in the corner, the green button.
Okay.
Thank you.
Thank you. There was a specific question about referrals. I just identified, as I shared with you before, that there's over 12,289 cases that come into the hotline, and 58% of those are physical abuse. This project is specifically only able to fund up to 1,000 children. So we wanted to focus in a little bit more in talking with you further about how we would identify, of those 12,000, which kids we would get started with first. I've asked Christopher Cabot, Deputy Director of Children's Services, to come up and speak about how Children's Services and Canopy partner together and will identify these cases.
Good afternoon, Christopher Cabot, Deputy Director, DCFS. I just want to first say that we're super excited about this partnership and this multidisciplinary approach to child welfare. As Jen stated, Jennifer stated, we're on pace this year to even eclipse the 12,000 screening referrals we had in 2021. So the volume of meeting 500 per year is not going to be an issue at all. So we are going to be using sort of an assessment tool or looking at certain cases to make sure that the appropriate ones are referred. So when we think about the child protection team and what cases we think would be best suited, those would be children with multiple unexplained injuries, injuries in different stages of healing, and then some of the other child vulnerabilities. So like Ms. Johnson has age on here. Well, age is one of the child vulnerabilities or characteristics that we look at, but we'd also want to look at the physical, social, and intellectual capacities of the child, their ability to self-protect, and their just their physical stature, a lot of other things that would come into account before we would make the referral. So, the other thing that we'd want to take into account would be the reoffending behaviors. So if Children's Services was involved with a family and then maybe the family went through some services, we closed the case out, and then they were brought back to our attention for similar behaviors, I think those would be cases that we would also want to take or maybe refer to this multidisciplinary approach, because if you think about the major child welfare facing systems in the hospitals and prosecution, everyone at the table, perhaps one of those partners at the table sooner or previously might have had helped to have a different outcome. So we're hoping that to take a look at those cases. That's about it. So again, with the amount of calls, I think our problem would be not so much as to what cases, but really, trying to identify the ones that would be best suited there. We do have the medical investigations unit currently at Children and Family Services. They would be the lead for our agency in handling these types of cases. We might have to increase the staff by a couple, but we're equipped to do that and ready to do that.
And what was the name of that,
It's our MIU Medical Investigations Unit.
the medical?
Yeah. Thank you.
There were some questions, and it's understandably complicated to understand, related to HIPAA and how information could be shared amongst the three health systems. And so what I did was there's a policy statement that's produced by the American Academy of Pediatrics that it's a 7-page document, but I highlighted for you on this slide about what enables the ability for pediatricians when they have identified child abuse or have concerns about child abuse for them to be able to share information in accordance with HIPAA. This comes right from HIPAA. And if you'd like that additional document, I can share it with you as well. The Ohio Revised Code also has an ability for physicians and pediatricians and medical personnel written into it for them to be able to share information. So I have pieces of the code here. The sections in the yellow are the ones that specifically talk about healthcare professionals and their ability to share information as it relates to child abuse. And that's the one that's on the left. And then on the right, there's a specific code for children advocacy centers when all individuals are signed on to the MOU that enables the investigative and follow-up and continued ability to be able to talk about the cases. So with those three things, along with our partnership with the health systems, we should be able to transform our ability to communicate. But I specifically asked Metro Health, who we are going to work with along with Cleveland Clinic and University Hospitals, to come share some information about the medical services specifically.
Hello, I'm Jennifer Baylett. I'm from Metro Health Medical Center. So the first question was the number of staff specifically and what were they going to do? So it's 2 RNs, one of which is a SANE nurse. The other is just a regular RN. 1 physician, a 0.4 of a nursing assistant, 1.3 of a secretary, and the numbers refer to FTEs, and 0.5 of a manager. So just to go through what those folks all do, a SANE nurse performs sexual assault exams in the clinic. She'll document as medically appropriate, goes to multidisciplinary meetings and testifies. The other RN will work in clinic to assist the providers during exams and procedures, act as a chaperone for exams, drawing blood, collecting specimens, and otherwise duties sort of as assigned. Physician will staff the clinic, see the patients, participate in multidisciplinary meetings, document, testify. Medical assistant identifies the patients, takes vital signs, brings the patient to the room, cleans the room, works with nursing for specimens. Secretary is going to register folks, works with the medical staff on paperwork, supplies, equipment, maintains stock in the clinic, answers the phone. And then the clinic manager, who will be a Metro Health employee, who will help coordinate all of it. She functions as sort of the, helps with schedules, helps with patient schedules, helps do customer service when needed, coordinates among agencies, et cetera. How will data sharing work? And I'm going to speak to the part about the hospital providers from the 3 different systems. What will happen is it will be a Metro Health clinic. Metro Health will contract with either CCF or UH for the staff in something called a professional services agreement. So when those staff are working at the Metro clinic, they function under legally as a Metro employee, and Metro employees can talk to each other about the case at hand. Then additionally, in the same ways that Children's Services or other interested parties would subpoena or get a court order for information, they would go through that same process. But the 3 hospital systems have agreed to use the same forms, have the same criteria, so that it's sort of, if you will, one-stop shopping. You fill out one form that will work for all 3 systems. There'll be a medical records clerk at Canopy who will be registered with each of the 3 systems to be able to pull records. So it makes it much easier for our partners to be able to get the things they need to protect the children. How are the hospitals going to track and duplicate, make sure there's no duplication of work? The electronic medical record is the same for Metro Health and for Cleveland Clinic. UH will be on that as well. Deep within that system, there's something called Care Everywhere, where the 3 systems will be talking. They do talk now. They will be even better when UH is on the new system. And so essentially, when I open a record of a patient, I can see all their visits at the other systems as well. Now, there are some exceptions to that. If the child has changed names multiple times, if the parent has specifically said you can't share those records, it will block it, but that happens very rarely, and for most instances, it's pretty seamless. And like I said, we'll get even better when UH becomes an EPIC member. Who is specifically going to ensure coordination with Canopy and with the other partners? So we will have a clinic manager whose half-time job is to coordinate amongst these entities, somebody who will be experienced with the Metro Health system, but also with these professional services agreements. We'll obviously learn the other partners as we go through. There will be daily meetings to help troubleshoot in the clinic, the day-to-day kinds of things. And then the hospital executives, there's an executive advisory group, which is representatives from each of the 3 hospitals, Canopy and other partners as needed, to sort of keep direction and troubleshoot any larger issues that come along. So I'll stop there if there are any questions.
So, and I'd like to ask you a question. So
Sure.
in terms of the clinic manager and I think another staff that you had, clinical staff you had mentioned, that they'll be from Metro. How are we paying? Is Metro paying half of their salary and this funding will pay?
We'll pay the other half, yeah. Or we might get somebody part-time. I don't know who we will find yet. We unfortunately can't hire until we have the contract, so we'll look amongst our own staff and then towards hiring if needed.
Okay. Jennifer, Executive Director Johnson, can you let us know how that pans out?
Yes, ma'am.
Okay.
There was some question and discussion about how we would connect with social services. We have a lot of social services that we connect with already, but specifically around Say Yes, because of the programming that they currently have in the school system. We have positions within this proposal that, including, in addition to myself, there's a program manager and there's also an associate director position, and both of those staff will work to identify what's currently being offered through Say Yes and how we can coordinate with them in the ways that make sense for both organizations. And as it relates to the same concept will apply to the rest of the school systems as well. There's several other social service organizations that we partner with. You heard from many of them the last time that we spoke, and I can provide those to you as needed as well. There were also some questions about therapy, recognizing that there's only 2 full-time therapists in this proposal and that there's a much greater need to be able to meet the need for the kiddos that we see. If we're going to see up to 1,000 kids over 2 years, 2 therapists is not going to be enough to meet that need. That is clear. What I can say is that there's a process in place that we have where we will assess the need. We will identify if they currently are getting therapy from somewhere else and work to help those therapists be able to meet that need. And if they're not able to meet that need, we will begin to triage which kids need the therapy based upon their trauma symptoms the most. And we'll work to also strengthen and build additional partnerships so that we can refer out to therapy when needed. Any questions on that?
Yes, does DCF have a therapist now that can kind of work with this?
Is Jackie here? Yes, they have a therapy department. Do you want to speak to that?
Sure. Again, David Merriman. Yeah, there are therapists at DCFS. They're limited. I think there are 4 for the entire agency. So they do support children, but their assignment is also limited. So that's where the need for coordination becomes clear, because we have limited capacity, they have limited capacity, and that's where Chris Cabot's team's role and the medical unit's role of making sure that coordination and that assignment has us leveraging each open spot to make sure that we're serving the right kid at the right time.
Okay, so we currently have 4. This is, even though it's an outside agency that we're coordinating with, there's 2 new full therapists that are being brought on board. And testimony today is saying that there will be a coordination amongst the 2 agencies in order to fulfill all of the therapy needs that the children. So I'm just trying to understand before someone comes back and says that they need more therapists. I hear that you're saying we're going to need more therapists. What is your thoughts on that, David?
First, I'm going to ask Jackie Fletcher to come forward. I think clearly there's a limit to the amount of therapeutic resources we can provide. We have 4 staff that do this. We have other staff that provide multi-systems therapy in other agencies, but I think at the same time, there is not enough, and that's not something that can necessarily be addressed out of this contract. So I think that's all the more reason for us to be coordinated, for us to be working together. Let me see if Jackie would like to add anything to that.
Good afternoon, Jacqueline Fletcher, DCFS. Just to add to that, no, there's not enough across the board. However, we do have a hiring event scheduled for tomorrow, and we're specifically engaging in candidates for those positions. So hopefully we'll get somebody interested in the therapist position.
Are we looking at full-time or have we considered part-time therapists?
Ms. Fletcher, can you speak directly into the microphone? Thank you. Louder.
Sorry, thank you. Yes, we're looking for full-time. The part-time positions are specifically around our child protection specialists.
Any of my colleagues have anything on this line of questioning?
Yes.
Councilman Miller?
I'd like to follow up and ask what it would take for us to develop enough resources, either both within our own agency and through Canopy and other partners, so that any child that needs treatment can receive it.
That's a great question. I think there's a lot of, and David and Jennifer spoke to it, it's a lot of coordination that has to happen on the front end to make sure we're getting folks identified earlier on and streamlining those referrals. There's a lot of community-based programming that's out there. Providers are available. Service delivery, I believe, is down across the board as the pandemic has gone on. That's some of the reports I'm seeing is, referrals have slowed a little bit. So it's just trying to make sure that folks who need the help know where to get it. And again, we're advertising specifically for those therapist positions because we know those services are needed. So coordinating and collaborating with all of our partners is sort of critical right now, just to make sure we're not missing anyone, and all the services that's available, folks can connect to those. You want to add to that?
Just as a nonprofit, there's a real struggle to fill mental health therapist positions right now, and in the community mental health arena, especially, primarily due to salaries and the inability to pay people the same level that clinicians can make in private practice settings, in settings where they only have to work 2 or 3 days a week, where they can see clients via telehealth. And our kiddos, the DCFS kiddos and Canopy's kiddos, need to be seen in person, and they need to be seen in the community sometimes to help eliminate barriers. And oftentimes, community mental health organizations, Canopy is not one, but though we're a nonprofit, struggle to be able to pay therapists the same amount of money that private practice could, and can't keep up with it. So as soon as we hire someone, we want people that are experienced, because we're seeing people who have a high level of trauma, and that's true with DCFS and with Canopy. The experienced people are able to find positions in other organizations with more funding. So the short answer is additional for the nonprofits, and for Canopy, specifically additional funding for the right kinds of therapists. Councilman Miller.
Okay, thank you.
In Director Fletcher's statement, she said we partner. So does that partnership include CMSD school therapists and things of that nature, so we can?
I can double check. I think at the front door, we're definitely partnering to ensure that when we get referrals, we know what services youth and families are engaged with. And so sometimes we have kids that come to our attention that's already involved with a therapist in the schools. So partnering with them to make sure those services are continuing wherever that child may or may not go, as well as our community health agencies and anyone else that child is involved with. So absolutely making sure we understand what that continuum of care looks like for the child.
Okay, thank you. You can continue, Director.
I am pressing the button, I promise. Oh, I might have went too far. Thank you so much. So this is just a case example. It's not a specific case. It's not a specific child that has been seen at the CAC for HIPAA reasons and sharing reasons. It's a combination of many stories that we have from our partners and that we know exist, and examples of what does exist in our community now versus what could happen with a child protection team. It's on several slides, but I'm going to read through it just so that you can get a picture. There's a 5-year-old child who's picked up by the father from the mother's household for a routine visit. The parents live in separate homes, and he's noted to have an extensive bruise to the face. He's concerned, and he takes the child to a hospital emergency room. The emergency medical provider documents the injuries and indicates that they are medically minor and no follow-up is needed, but he does make a report to the Child Protective Services staff and then sends the child home with the father. The Child Protective Services worker comes out and does an assessment, sees the bruises are present, but they appear to have been able to occur from several different opportunities, given that the child's 5 and the child's mobility. CPS meets with the mom in her home. She explains that the child fell and hit their face on a piece of furniture. There's only one prior incident of alleged abuse in the home, and that was with the father that was unsubstantiated. That means that it didn't occur or they didn't have evidence to show that it occurred. And there were no prior reports to the Child Services Hotline regarding the mother. Therefore, CPS leaves the child in the care of the mother with the scheduled visits occurring with the father, and a case plan is set up that includes Child Services checking up on the child in the mother's home in 1 week. Child Protective Services comes out in 1 week, sees that the bruises are improving, and notices no other areas of concern at the time of the visit. They agree to come out once more a week later, complete this visit with nothing noted of concern, and close the case. 6 weeks later, on another visit to a different hospital emergency room separate from that first one, when Dad picked the child up for the routine visits, and there were new bruises on this child's head, the child is assessed and determined to have minor injuries at that emergency room. He's sent home with Dad, and no follow-up is done. Then the child returns to mom as per routine, and 2 weeks later, a call is made to EMS because the mother reports the child was found unresponsive. When the child arrives to the emergency department, he is unable to be revived. An autopsy later reveals that his death was a result of blunt force trauma to the head from an outside individual. At this time, Child Services and law enforcement become involved, and they try to work to determine who caused the trauma. The end result? There is no access to a medical child protection team specialized with the right individuals to respond together. The child is placed back home, abused again, and death occurs. With the child protection team model, the 5-year-old child is with father, is picked up from mom's home for a routine visit. He has a bruise on his face. Dad is concerned and takes the child to the hospital emergency room. The emergency medical provider documents the injuries and indicates that they're medically minor, but given Dad's concerns of child abuse, he contacts CCDCFS, and the newly formed medical child protection team enables a medical exam and forensic interview to be scheduled the next day at the CAC. The medical exam is scheduled at the CAC. The medical child protection team arrives and applies specialized knowledge, skills, and testing when they conduct the examination. They document that there are features of what's called a sentinel injury, and that while they look medically minor, they represent that the child is in or has been in an unsafe environment. And if placed back into the same environment and the abuse continues or escalates, the child will be re-injured more severely internally with long-term consequences, such as brain damage or fatally maltreated. With that information, Children's Services is able to receive it and a well-documented medical report. They cross-report possible concern of a criminal charge to law enforcement, and they complete a forensic interview at the Child Advocacy Center with the child. Law enforcement, Child Protective Services, and prosecution participate in the interview together. They learn the details of incidents of physical abuse occurring by child's mother's paramour in her home. A victim advocate meets with the child and provides support, and the team works together to determine a safety plan for the child. Temporary custody is granted to the father, and the child goes home. The Child Protective Services worker makes a referral to a mental health services, and the child is scheduled to receive a mental health assessment in 2 weeks. Law enforcement has the evidence needed to utilize what they need to do with the medical examination, the forensic interview, and Child Protective Services to be able to file for an arrest warrant for the mother's paramour. Mother is given an opportunity to have visits with the child in a safe and secure visitation setting, and the child is able to begin working with both parents and long-term healing. Multidisciplinary case review is held weekly with the medical child protection team present, where this child's case is reviewed and all parties involved to ensure that each member can get what their portion of the case needs in order to expedite intervention and offer justice, limiting the traumatization to the child. Prosecution accepts the case. The end result is that trauma-informed services are provided, information is shared comprehensively, tangible supports are put in place that protect this child from the start, further abuse is prevented, and ultimately death is prevented. That's how it works, how it should work. Any questions about that? Okay.
I have a question.
Yes.
Councilman Miller.
So, given given that the abuse did not seem severe, and that you've got way more cases than you can handle, how do we know that this case is going to even get to the child protection team?
When Deputy Director Christopher Cabot came up and spoke, we're going to work together when we first launch this program to identify screening criteria. A case like this may or may not have went to the medically intensive unit that Chris is talking about, but examples like this are going to be utilized for us to work on the criteria to make sure that the cases get referred to us. But we can't hit every single case. You are correct that it's possible that we might not get to every single one, but what's happening is that we're not getting to any of them in this way right now.
Councilman Sweeney.
Thank you, Madam Chairwoman. Thank you for your wonderful testimony. It's just something that's heavy, but important. We got to keep figuring it out. The one question I have, you said they'll respond the next day.
The medical child protection team. Next, if this would have happened on a weekend, the next business day. This story was on a Monday, and
But just, that's a great goal through the chair.
Agreed.
Are we going to be able to, I mean, it could be 2 days, 3 days, but 1 day is what we want, and we're going to produce it, and if we don't, we'll try to get the resources to meet that threshold.
Yes, yes. To be able to have a 24/7 response team with medical child abuse professionals in that way costs a lot more money than what was able to be given in this opportunity. But it's definitely the goal. It's how a medical child protection team should operate. It is what was recommended and requested by the white paper that helped us get to this point. So it's definitely what we wish for and desire for. I know that CCDCFS would agree with that as well.
And through the chair, I think that's a critical timeline. It happens the next day, and then we can address it. So I'm just fully supportive. I just wanted to ask the question so I get a little more thorough of an understanding.
I agree. Thank you.
Councilwoman Turner.
I think that the acronym was MIU.
Yes, medically intensive unit. Is that correct, Chris? Medical investigations unit.
Unit. You mentioned something about the child's ability to self-protect, Chris. Can you talk a little bit more about that, and with what age are we talking about here?
Again, Christopher Cabot, Deputy Director, Children's Services. Yes, age is an important factor. When we kind of think about an age that we would be kind of starting at, we kind of came up with the age of 12. But again, there's so many different characteristics and factors that go into that. Again, as I was talking about earlier, their physical ability to self-protect themselves, their intellectual capacity to know the difference between right and wrong, right? Their social connectedness. I mean, who can they reach out to when they're in trouble? Their role in the family, are there unrealistic expectations put on the children? Are they parentified? Are they taking care of younger siblings? Again, some other things that come into play, just besides the children's characteristics, are also just some of the family dynamics. Their ability to take themselves out of dangerous situations if there's DV in the home. Kids sometimes even feel obligated to protect one parent from another or things like that. So there's a lot more that goes into it than just age, but obviously the younger a child is, the more vulnerable they are to not being able to self-protect or to being seriously injured, if, abused in a certain type of way.
So with that, if they were older, with that, in terms of your 12,000 plus cases that you have, trying to prioritize which case you would take, would that, if they were older, would that eliminate them?
No, and I do want to put that a little bit in context. So just the 12,500 or so that Ms. Johnson spoke to earlier is actually the number that were screened in. So those are actually ones that we went out and investigated. We actually receive over 40,000 calls at our hotline every year. Oh. So we receive about 140 to 150 calls a day. So there's constant triaging and screening going on at our hotline. like I said, with the number being 500 a year for the 2-year period, we would have no problem identifying cases that would meet the criteria. And I mean, we just, couldn't welcome the extra eyes and assistance on these cases enough. So.
Thank you, Madam Chair. Thank you.
And that's just one piece of the criteria. So there could be an older child too, depending on the severity of the abuse and different things that would be considered. I think for the sake of time, I do have Jeffrey Schnatter from the Cuyahoga County Prosecutor's Office and Matthew Golish from Canopy's Board of Directors here if you have questions for them specifically. But I don't need to have them come up if you would rather not, because I know you have a full agenda.
He came.
Okay, all right.
Good afternoon. Thank you very much. My name is Matthew Golish. I've been involved and on the board of directors with Canopy for the last couple of years. I got involved because in 2001, I tried my first murder case as a prosecutor. The defendant was a 13-year-old who had shot his dad in the back of the head in Shaker Heights. And it was the first battered child case that we had ever seen defended here in Cuyahoga County. His name was Gregory Scruggs. And in the course of prosecuting that case, I realized that he had been reported to Children and Family Services a half a dozen times. He went to Shaker Heights schools and was reported all over the place. Everybody knew about what was going on with the child abuse, physical child abuse that this young man was subjected to. We're judged as a society by how we treat those most vulnerable. And these kids are our most vulnerable. From the sexual abuse aspect of it, I remember that same summer in the basement of the old juvenile court building, trying case after case of family member on family member juvenile rape cases, and not having an opportunity to have a social worker there, not have an opportunity to have everybody sit down and talk about what's best for the child, period. We think about it, we think about these cases, and we think about in the old days, when I did it, you'd take a child into Metro ER, then they'd have to go to Cleveland Police Sex Crimes, they'd have to go to the Justice Center, they'd have to go to Jane Edna Hunter. And that's before they even touched a therapist. That's before they even had an opportunity they had to tell that story 5 or 6 times. And so you'd get 5 or 6 statements that didn't necessarily match up to time and place. This is an important thing that we are doing. There are 1,000 of these around the country. And while we are just getting off the ground now, we need the support of everyone we can get to try and bring this and serve all of these kids that are in need. I'm a CPA and a lawyer, of course, so if you have any financial questions about any of the budget, we spent an awfully long time. I'm happy to answer those, but thank you.
Thank you. Thank you for your testimony. So I want to wrap this up because we need to move on unless some of my colleagues have questions. This is legislation has been through a lot, and I'm sure there's going to be some more questions because it's new. It's what we need. My thought is, as a county, we are always reactionary problems and issues, and I want us to really move toward how we're more preventative for issues. And I thought when this was presented, the white paper was presented to us in regards to what this contract would do, that it did have some preventive measures in it to protect some of the children. So, that's what I'm interested in making sure we have the ability to get children out of the homes. We're very good with that. how are we working? My concern is how are we working to address placement issues for some of these cases, because some of these children depend, when they're removed from the homes, on their family getting better and getting the help that they need. So it's not an easy, and I think we're lacking in that area here in the county of having, once we remove them and keep them safe, having an appropriate placement or home for them to go to. So that's some area that we need to work in, Councilman Miller. And then having the appropriate resources for the families that can get it together, and we can reunify the children back at home. So all that comes with prevention and partnerships with CMSD, the medical staff when they do see a child in their ER. So that's all I have to say on it. I think we'll be working out the kinks of this legislation. Just, I see what you guys and the children protection teams need across the county and across the state. But then the counties and DCFS, it needs to be a strong partnership because we have needs as well. So we can take the kids out but we got to have somewhere for them to grow and prosper as well. So, Mr. Miller, if you'd make a motion to move this to the full council under second reading suspension, I'd appreciate it.
Madam Chair, I so move.
All right. It's been moved by Miller, seconded by Turner. All in favor, please say aye.
Aye.
And thank you all for coming out today, and I'm sure we'll have further discussions.
Thank you.
You're welcome. Madam Clerk, if you could read the next item into the record, please.
Resolution 2022-0436, making an award on requisition 9347 with Strata Collaborative DBA Inside Track in the amount not to exceed $2,500,000 for coaching services to Ohio National Guard scholarship recipients for the Pay for Success program for the period October 1st, 2022 through April 14th, 2030.
Thank you.
Again, good afternoon, David Merriman, Department of Health and Human Services. There is a presentation. I'm going to move through it somewhat quickly. This item was before council. In fact, it was before this committee earlier in the month related to its finance and appropriation. So the slide deck that you'll see has some updates. We'll also be answering some of the questions that came out of that committee. The main point is this is a workforce program with a regional scope. We are going to be providing our Ohio National Guardsmen access to executive coaching to help them advance through their careers. We're going to leverage experiences and skills developed during the COVID era as they supported us in the jail. They supported our community doing food distribution. They supported our community doing COVID vaccinations. All of these opportunities presented professional developments that Guardsmen engaged in and developed new skills and experiences that we think are critical to our community. Significant change is that on November 9th, 2022, County Council voted to appropriate Social Innovation Fund dollars for this project. We now have the funding available to bring forward today's contract, and so we're going to be asking for approval of the contract. A reminder of how the program works. This is a Pay for Success project where Maycomb Capital will provide upfront funding to Inside Track. Inside Track will provide the services to the Ohio National Guard scholarship recipients. The Ohio Department of Higher Education will validate whether those services resulted in outcomes, education outcomes. They will report that information to us, DHHS, and we will repay Inside Track. I'm going to ask Anthony Lamb to come forward. He is a retired colonel, lieutenant colonel from the Ohio National Guard. He can speak to the scholarship, and also we'll talk a little bit about how the program addresses some critical needs within our state.
Thank you very much. Again, Anthony Lamb, representing the Ohio National Guard. And first of all, the scholarship is fully funded. So these are people receiving a benefit. They have made an enlistment for 6 years of active service, or 3 years. And they have a benefit that they can use. The problem is that many of them are struggling to be able to complete their usage of it to get either a degree or a credential. And our hope is that our participation in this project will get more of them to become people who have completed their degrees and have either, if they haven't completed a degree, they've gone on to get a certificate to operate in your workforce. That's really our goal.
Thank you. I'm going to ask Strata to come forward. Strata is a representative from Strata to come forward in Inside Track. Because this is a new organization to our community, and what the services they provide, the executive coaching they offer, are delivered on an individual basis and really address the varied needs of the National Guardsmen.
Hi there. I'm Jessica Hector, Associate Vice President of Partner Success at Inside Track. I've been with Inside Track for 8 years, and I'm an Ohio resident. I was born and raised here in Ohio, and my father actually is retired from the Ohio National Guard. So I think it goes without saying I'm very excited to be here today to be able to present this project to you all. I want to take briefly just review who we are at Inside Track and a little bit about our coaching. As you all might remember, my colleague Bobby Godby was with you all last month. And Inside Track, we are a nonprofit owned by Strata Education Network. For over 20 years, Inside Track has used personalized, one-on-one, executive-style coaching to help all learners achieve their education and career goals. You can go to the next slide, David. Thank you. Oh, we don't have a slide. There it is. So, coaching is all about tailoring our work to the individual learner and their specific goals and where they are in their education journey. We focus on 8 key areas that impact enrollment, retention, and completion. Areas that are tied directly to our research on why a student might not be successful in their educational journey. We use these focus areas to assess and address a learner's strengths, opportunities, and red flags. I do want to highlight this approach allows us to meet the diversity of the learners that we coach. Not only are these guardsmen balancing their education, but also their career, their families, and their service. And our proactive, personalized coaching uses non-cognitive skill development to advance those learners from identifying and personalizing goals through that goal fulfillment. By putting that learner first, and in the case of the Ohio National Guard scholarship recipients first, we'll not only drive academic and career success, but we'll also be able to provide real-time insights into the institutions they're attending, their experience with the National Guard, as well as the workforce pipeline here in Cuyahoga County. We believe that helping a single person achieve their educational goals and move on to the career they aspire to can have a lifelong impact, not just on that individual, but also on their family, their community, and society as a whole. It's because of that.
Realizing there was a slide that was out of order, so I'm going to go back to it one. So this actually addresses one of the questions that Councilwoman Conwell brought forward. And I think the slide and the information is somewhat small at the bottom, but it speaks to how Cuyahoga County does compared to the rest of the state. And unfortunately, it's not great news. So generally speaking, our rates are lower than the peer-wide averages for both entering and completing a 2- and a 4-year degree. And there's especially a concerning significant gap between white and black guardsmen in these programs. So this is one of the questions that was brought up in committee, so we wanted to focus on it. The details provided in the notes at the lower portion of the slide. So the other major update that I do want to just focus on is we're very fortunate to find an investment partner that really saw the vision and committed to working with us to finalize the construction of this deal and this project. And I'm going to ask Simone to come forward and share a little bit more about Macomb Capital and their interest in supporting the project.
Hi all, I'm Simone Gross, Director of Investments at Macomb Capital. Thank you so much for your ongoing interest and
Ms. Gross,
consideration
if you
for
could
this
speak
project.
directly into the microphone a
Sure.
little louder. Thank you.
Sure, thanks so much. So I'm thrilled to be back here again for us to continue discussing this project. I'm also really excited to share that I have approval from our investment committee to go forward with this project. So we are ready for it to launch as soon as possible. We are thrilled to be here because, just as a reminder, we provide flexible, impact-driven outcomes financing to expand high-quality human services in underserved communities. And we really see the need here, and we're very compelled by what we had learned from David, in particular about all the services that the Ohio National Guard had done during COVID, and really see this as a great opportunity to help fix some of the disparities that we're seeing here in terms of enrollment and retainment and completion of higher ed outcomes.
So this project, and all of the presenters will be available for questions if there are any. What sets it apart from other projects we've presented is that we are only making payments. Cuyahoga County is only making payments when 3 goals have been achieved: matriculation, a guardsman entering school, a college, a university, a trade program, term-to-term persistence, they're staying in that school or that program, and they're completing. They're graduating or they're getting their certificate. And the matrix or the metrics that we're going to use, or the metric rate card, really shows not only the significant focus is going to get our guardsmen completing college, 2 or 4-year degree, or a certificate, but also that we are going to incentivize and fund differential payments for Black and African American and other minority students. We see that this racial disparity is a concern, and whether it's a disparity or whether it's just a function of the way that the programs are currently being provided is something that we're not as focused on as much as ensuring that the students move through whatever education program they choose. I do want to acknowledge the Ohio Department of Higher Education has prepared a video. They've sent it on in the purpose of time. I'll provide it to each of you. We'll send on the video. It speaks to why they focus on subpopulations and kind of what their commitment is. But I think for today's discussion, what I'd like to do is I think I'll just wrap this up and acknowledge the following project outcomes. First and foremost, this is a program that will serve Ohio Guardsmen and help them to advance their career. It will address their needs on an individual basis. Secondly, this is about workforce. We are committed to supporting the workforce needs of our community, want to focus on Workforce Connect, our area sector partnership programs, but also other jobs, other careers, and other training programs that exist in our community. We want this to be a return on investment the state already makes with our guardsmen who are getting access to these scholarships but are not completing them. We think the investment of tuition is really significant. It's something that clearly drives participation in the Ohio National Guard, and we want to see it all the way through. We want the guardsmen to complete the training programs they've begun, or the education. Fourth, we talk about statewide education goal attainment. More students need to be completing college statewide. This has got to be a top priority for all of our students and all of our guardsmen. This presentation today, this project is designed to help us provide coaching that is individualized, that will ensure that number one goal stays a focus of every interaction. And then lastly, I think there is something exciting about building a sustainable infrastructure that enables us to make success payments. We're not paying for services. We're only paying when we can show, in fact, that a positive outcome has been achieved. With that, I think I'll close, and I'll ask if there are any questions.
Yes, I have a couple. This contract, Mr. Merriman, starts when this legislation is signed by the executive. When will it be implemented?
Start of next year. I think we're doing some pre-work right now, but I think as soon as the contract's done, we'll begin services early next year.
Okay, does that put a dilemma in how the time period in the legislation is stated?
So I think the signing of the contract enables us to bring staff on. It'll give the assurance to Strata that we can hire up. It will also show the lender that we're committed to doing this, and so they can begin to prepare making payments. So having the contract done, having it completed before the end of the year, before any other delays, gets us that much closer to launching services. We'll probably have a slower ramp up because it'll be in the middle of a semester, which is okay, because that will give us time to figure out the mechanics of making referrals and doing services.
Okay. And how often will council be given an update on this program?
there'll be a formal update every year, but we're going to do a governance committee, and I've invited council to sit in on that governance committee, whether it's council staff or someone else. If they want to have a member sit in on the governance committee, I think we're going to meet quarterly, really talk about progress, talk about success in it, and that invitation has been extended.
So formal update every year to HHS. And then you said there's you're planning on a quarterly governance?
That's right. It's a performance committee where we'll look at how the program has been implemented, if they're encountering any challenges, early successes, and it becomes a problem-solving opportunity for us to really kind of have open discussion about how's it going and what needs to be done.
All right. Any other questions from my colleagues? Councilman Sweeney.
Thank you, Madam Chairwoman. Director, as I said before, this is, congratulations. You put a great team together, and great's an understatement, and I look forward to learning about the successes from the Ohio National Guard, and it's well-deserved, and I wish you well, and let us know how we can help.
Thank you.
All right. Hearing none, seeing none, I'll make a motion to move R2022-0436 to the full council under second reading suspension. Is there a second?
Second.
I didn't hear who did that second. All right. Moved by Conwell, seconded by Sweeney. All in favor, please say aye.
Aye.
All right. Madam, thank you. You're welcome. Madam Clerk, if you could read the next item into the record.
Resolution 2022-0437, making an award on requisition 10016 to Belfair Jewish Children's Bureau in the amount not to exceed $504,000 for mentoring services for youth in permanent custody of the Division of Children and Family Services for the period October 1st, 2022 through September 30th, 2024.
Good afternoon, Marcos Cortez with Health and Human Services. I don't have any fancy PowerPoints for you today.
Marcos, can you speak directly into the microphone? Thank you.
We heard that.
Okay. DCFS has partnered with community-based organizations to provide high-quality mentoring services since 2014. And in 2017, the program expanded to include youth from between the ages of 10 and to 21 who could benefit from a healthy, caring adult relationship to help support their emotional and behavioral growth. The program pairs youth with trained mentors who assist them in achieving school success, improved relationships with peers and other adults, and eventually successful transition to independent living. We worked with DCFS to solicit proposals earlier this year. We released the RFP around in June of 2022, and it closed about a month later in July. We received one bid, we reviewed one bid, and that proposal was Belfair Jewish Home. We have Director Jackie Fletcher here to talk about the program further, and Greg Vasquez Norman from Belfair to answer any specific questions related to the program that you may have.
And bring Jackie up or no? Any questions so far? Okay.
Thank you, Jacqueline Fletcher and DCFS. Just very briefly, of course, as you know, when we have a little over 800 kids in our permanent custody. And so as we seek to find families for those children, we want to make sure that we're also meeting those children's needs as it relates to emotional health, their social health needs, and all of that. So mentorship is absolutely critical and vital to helping those kids do, just regular kid things, social activities, getting out in the community, partnering with an adult who can help coach and mentor and support them in all of their activities. And so this is absolutely critically vital to many of our kids that are involved. Currently, I believe we have 47 mentees engaged in the program. And so, hopefully we can continue to grow that opportunity for kids and families to be exposed to. But if you have any additional questions, I'll take those too.
All right. Not at this time. We can bring up Greg so I can hear a little bit.
Greg Vasquez Norman. I'm the supervisor of the Foster Youth Mentoring Program at Belfair.
What can you tell us about it?
It is a mentoring program that follows the standards of practice of the most well-known, well-established mentoring model in the country, which is Big Brother Big Sister of America. They've been doing mentoring for 150 years, done a lot of research, et cetera. So the program follows those same standards of practice and goes about it in the same way. It's community-based, one-on-one mentoring. So we help young people develop a friendship with a caring, consistent adult, and ideally, we ask for at least a 1-year commitment from the mentors. But what we are trying to do is put a piece of a safety net in place for young people. Create a long-term, if not forever friend, while the county works on permanency for them in terms of their residence, et cetera.
Okay, so just trying to understand the connection a little bit. So you guys provide the mentees.
We provide the mentors.
Mentors.
So we recruit the volunteers, screen them, interview them, train them, offer them matches. If they accept the match, proceeds from there.
Are these children, Director Fletcher, I see that they're in our custody, but are they also placed at Belfair, or these are just any of our children that are, okay.
Our kids that are in our permanent custody can have opportunity for this connectivity if there's a mentor available for them. So no, they're placed all over, but the majority are in foster homes.
Okay. And so how did they, Mr. Vasquez, how did the children, do you go and see the children, or how does that work?
Well, once the referral is made, then we complete interviews with the young person themselves, and then also with their guardian, who's their case manager, children's services, or another adult that's involved in their life who has an informed opinion about how they're doing and how mentoring might work well for them. The program is voluntary, so on occasion we have a referral that's made for a young person that's not even interested in the program. It doesn't happen very often, but on occasion. I think it's a nice aspect of our program that it gives young people, a voice and a choice every step along the way.
Okay. And how are you invoiced? How do you pay for the students that do participate, or the children that participate?
Generally, we have our contractors invoice us monthly.
Okay, okay. Any other questions from my colleagues in regards to this? Okay, seeing none, hearing none. Any one of you have anything additional you'd like to add? All right. So if I could have one of my colleagues make a motion to move this to the full council under second reading suspension.
I so move.
Second.
Moved by Miller, seconded by Turner. All in favor, please say aye.
Aye.
Thank you. Madam Clerk, if you could read the next item into the record, please.
Resolution 2022-0438, authorizing an amendment to a master contract with various providers for the Supplemental Nutrition Assistance Program to Skills, Employment, and Training Services for the period October 1st, 2020 through September 30th, 2022, to extend the time period to September 30th, 2023, and for additional funds in the amount not to exceed $1,414,475 for the various providers listed 1 through 7 on the agenda.
Good afternoon again. Marcos Cortez with Health and Human Services. The purpose of the SNAP to Skills Employment and Training Program is to address the employment and training needs of our SNAP recipients, specifically to increase the number of SNAP participants who are able to obtain employment at a wage allowing them to sustain their family, to increase the rate of SNAP participants retaining employment, and to increase the rate which SNAP participants locate, obtain, and maintain sustainable employment opportunities. Originally, we procured these services through an RFP back in late 2020. So this is an amendment to that original contract. Our plan is to issue another RFP towards the end of 2023. We have Director Kevin Gowan here from JFS, Paul Bounds, the program administrator. I believe there might be some representatives from some of these agencies here who can answer any more specific questions related to the program itself.
All right, and there are seven, these the only seven or agencies that bid it for the contract?
I believe originally there were only a few, and then some were added as an amendments throughout the last couple of years, and I believe we've lost one along the way.
And you said it'll come back to us?
We'll probably issue an RFP probably in July of 2023.
Okay, so this is the third year of that contract.
Original.
All right, any questions from my colleagues? Any further information you need from the director or Mr. Bounds? Okay, seeing none, hearing none. We'd like to move this R2022-0438 to the full council under second reading suspension. Is there a second?
Second.
It's been moved by Conwell, seconded by Miller. All in favor, please say aye.
Aye.
Resolution 2022-0439, authorizing an amendment to a contract with Lutheran Metropolitan Ministry for adult guardianship services for the period January 1st, 2021 through December 31st, 2022, to extend the time period to December 31st, 2023, and for additional funds in the amount not to exceed $605,285.
Marcos Cortez with Health and Human Services. Guardianship is a legal relationship with one person, the guardian, that gives them responsibility and authority to make decisions on behalf of another person, the person under guardianship or client. Situations that leave adults vulnerable and in need of guardians include serious health conditions, cognitive impairment, developmental disability, severe mental illness, and drug addiction. When a person is referred to Adult Protection Services of DSAS, the department determines a need for a guardian. DSAS attempts to find a family member suitable for the role. However, there are times when this attempt does not yield an appropriate candidate. In those instances, individuals can be referred directly to an adult guardianship program. Lutheran Metropolitan Ministries will provide guardianship for seniors and adults with disabilities throughout Cuyahoga County. This, again, was originally procured in 2019 through an RFP. We had an option year that extended it through 12/31 of 2022. We're requesting an additional year to continue this program through the end of 23 with plans to issue another RFP, again, probably around July of 2023, based on the agency's needs. Again, we have Natasha Petricola, Director of DSAS here, and I believe there might be a representative from LMM here as well, who can answer specific questions related to the program itself.
Okay, if we could bring the director up. Natasha.
Good afternoon, Natasha Petricola.
Good afternoon, thank you. So I know I have had different involvements with residents that have had family members in the adult guardianship services. And I don't know, I would assume some of my colleagues does as well. It's just a thought that just came to my mind based on the cases that I was involved with. I know DSAS advocates for them, but I was just wondering, is there ever been any thought, or do you have some kind of advisory group or whatever made up of different family caregivers for some of these tough cases? So in particular, there was, I know there have outside family members, but they may be out of town. And so when they find out one of the local family members are not acting on the best interest of their loved one, I don't know what that procedure is and how that outside family member gets to get an opportunity to have a say. But in one particular case, it was, a senior, and I'm just looking for the objectivity of the actual guardian, because we all make decisions based on how we will probably do something in our own life, and if you're not there at a certain age, how would you be able to make that decision? So my example is there was a 90-some-year-old female that was living on her own. Her family and her sisters seemed to all have longevity in the age which we all hope to attain. I think her niece at the time was her initial guardian or was acting on behalf as her guardian, and the lady's son lived out of the country. And so someone stepped in from guardianship, became the lady's guardian, and she had made a reverse mortgage loan. So, and I always use this story because, it's kind of like taken aback a little bit. So the senior, the rules are with the reverse mortgage, as long as you remain in your home, stay there. They can't reverse and take the home if you haven't paid back the loan. So this senior got ill and this is pre-COVID, got ill and had to be removed to the nursing facility for rehab. So that was the time that the bank instituted that, on a technicality, that because that senior was not in their home for a period of time, they took the property. So I always say that that's kind of like, really, I don't believe in reverse mortgage, but, I'm not here for banking services, but I'm just saying, for our guardians that are in those positions making those decisions, you really have to ask yourself, are you making the best decision possible for that person that could have returned and lived like a couple more years in their home instead of a nursing home? So that just came to mind, that story. If we could have, I don't know, look into it and see how we can have an advisory to kind of check up on some of these decisions that are being made for individuals that have worked hard in their life to obtain their home.
APS in particular, the client is the person's whose best interest, we're looking out for more than anything. They are the people that were the good stewards to investigate the allegation and then ensure that the proper course of action's taken if it's necessary. So all the clients that would be assigned the guardian obviously have gone through the process where there was a statement of expert evaluation completed by a neutral physician, and there has been concerns with capacity, which then kind of fuels the whole process. We work very closely with probate courts, so obviously the first line of defense is to always work with families. If there's a family member, we anticipate, if they're the good guy in the particular case, that they act in the best interest of that person that they're assuming guardianship over. But unfortunately, there's some where the family are the perpetrators in the case. We've got to kind of separate them from those individuals that are APS clients. Everyone, regardless, is always given an opportunity to attend the court hearing. We serve everyone in the party. So even if there are family members that we do not advocate become a guardian, they have the legal right to come to court and they are served as well, as long as we have information on them and we can contact them. Predominantly, the cases that go to adult guardianship services are those where they're indigent. Typically, if there's assets involved and there's family, sometimes family agrees to do maybe one portion of the guardianship. So you could have a split guardianship where there's a court-appointed attorney who could represent that person in the asset part. And then there's also the guardianship of persons. Some families take on both roles. If the family chooses not to, but there's assets, a independent attorney through the probate court then would be kind of the one responsible for taking on that responsibility. There are stipulations with the court. They have to make the report every 2 years to talk about fiduciary kind of things regarding finances, what money's spent on, any transactions that are done. But the clients that truly we are referring to guardianship services, again, are those that are indigent and don't have those family members. Now, there are times when cases are reopened in adult protective services because there is indication that the guardian is not acting in the best interest of their ward. So APS can open up another investigation as long as that person's in the community. So the case you described, it sounds like there were a lot of things that could have been possibly missed there. When somebody's in skilled care, the notion is that if they recover and recuperate, they are only skillable for so long, and they should return back into the community to their home. I'm not sure of how long that person was out of the home or what the exact details were in those particular cases. Typically, once the guardian is appointed, though, through probate court, and we have all the paperwork in that says that that transaction went through and it's legally binding, that's when APS does close the case. But it's not unheard of that we've had to open up cases again. Typically, obviously, that's not the case when we're working with guardianship services. They're all professionals. You know, they have the capacity to serve up to 532 clients. There are about 477 clients they're serving actively now as of October 31st. They do their own assessment, investigation. They ensure there's a compelling decision that the case should be opened with them and that they would take on the responsibility to be awarded. Last time I checked, they have at least, I think, 15 staff guardians, and I do have Kendra Daniels here as well from Guardianship Services and Michael Garvey, and they're two people that we work with exclusively, almost repetitively. Mike alone sits and comes to every one of our AP collaborative meetings. So even when we have difficult cases in the community and we're not sure what to do with them just yet, he's always at these collab meetings we have on a monthly basis that we do talk about some of the same individuals that hopefully come to our attention and we can address.
Any questions from my colleagues? Nope, hearing none, seeing none. All right. Anything else you guys would like to add? All right. I'll be back for a visit real soon to the guardianship program. It's about time. So if I can have a motion from one of my colleagues to move this. Moved by Turner, seconded by Miller, to move this to the full council under second reading suspension. All in favor, please say aye. Aye. All right. Thank you both.
Resolution 2022-0440, making an award on requisition 10161 with various providers in the amount not to exceed $6,468,017.08 for the Ohio Works First program for the period January 1st, 2023 through December 31st, 2023. For the following providers, Maximus Human Services, Inc., and B, the Centers for Families and Children.
Good afternoon again. Marcos Cortez with Health and Human Services. In 2019, Cuyahoga Jobs and Family Services issued a new RFP to procure services that were previously procured separately: job readiness, job placement, job retention, the Job Skills Center, intensive case management, and work experience program. At that time, two vendors received awards to implement this new model. And they have since then implemented. We issued a new RFP based on this previous design because it has functioned well. We issued the RFP in July of 2022, and it closed in August of 2022. We did receive 3 bids. We reviewed those 3 bids, and 2 were approved. Again, the primary goal is to assist OWF clients in attaining success by addressing barriers that may hinder the clients from achieving self-sufficiency. The approach to services are holistic, seeking to focus on addressing a broad range of needs of the individuals and at the household level, including but not limited to a full family assessment, job readiness training and education, and referrals to social supports. Again, we have Director Kevin Gowan here and Paul Bounds, the program administrator, who could answer more specifically questions on the program itself.
All right, I just have a question. Who was that third vendor? Because when we first, there was initially 3 back in the beginning for this type of contract. So who was the third vendor?
The other vendor was Equus Workforce Solutions.
How do you spell Equus?
EQUUS.
I don't think that was anyone we used in prior.
No.
Okay. All right. I always like to open up opportunities for other people to bid. I'm assuming that there was a scoring procedure.
There was. We had 2 teams review all 3 proposals. That gives us a greater variety of reviewers and scores.
Okay. By Equus being new, do we think sometimes that we, give them a little piece of the contract and see how different organizations work with the county?
I would defer to the department on how they want to proceed with providing these services. Again, we've currently, Maximus and the centers are providing the services. And again, they were awarded for the new time period.
And who was the third one prior? It was something with a V. I can't remember.
It might have been Verge. I wasn't
Yeah, I think it
around
was
at that
Verge.
time, but I
Yeah.
believe Verge works with the centers.
Okay. So they kind of merged over the
yeah.
years. Okay.
Well, Verge is its own individual agency, but I believe they partner with the centers.
Okay. All right. Any questions of the directors? Mr. Bounds, Mr. Cortez? All right. Anything else you'd like to add, Mr. Cortez? Okay, thank you for the great work that you do. I will move R2022-0440 to the full council under second reading suspension. Is there a second?
Second?
Moved by Conwell, seconded by Sweeney. All in favor, please say aye.
Aye.
Madam Chair, I'm going to recuse on this item.
All right, so we have 3 yeses and 1 no by Councilman Miller. All right. All in favor, well, I guess I said that already, right? Okay, you're
Yes.
good? All right, Madam Clerk.
Thank you.
Thank you. Any miscellaneous business?
Thank
Thing
you for a
anyone like
very
to share?
efficient meeting, Madam Clerk. Madam Chair.
Tomorrow, we need to be present for a reception we're going to have with the county exec to meet the HHS departments, heads of, the head of departments to make him aware of, or not aware, but open his eyes to how,
Introduce them too.
right, how intrinsic HHS is and the important work that each of you do every day. Thank you.
Executive-elect, right?
Executive-elect. Thank you. Keep me on point. Adjourned.